Doing okay?
Yes,
Is your pain same, different?
that's the same.
About the same, okay.
My back hurts a little bit. And slight stomach,
Okay.
pain in my stomach. We
Take
should
it.
find out.
Medication and then drink some coffee, you know.
Okay, so your pancreas is shaped like this. This is the head of the pancreas, and in this area here, there's a mass there. There's lots of inflammation kind of around this area, and angle it down here. Oh, you're not flipped around.
Oh, I'm sorry. Oh, there I go. I'm sorry.
Got it there? Okay. So this is the head of the pancreas. There's a mass right in here. Lots of inflammatory changes, really even coming over into here in the pancreas. So I tried to identify the area that looked most consistent with a mass pushing over into the bile duct as it comes down from the liver and through the pancreas. I could see the stent that was in the bile duct. So I did 4 passes with the needle into here, and there are atypical cells that look suspicious for cancer cells here, okay? We have to wait for our final diagnosis for that, but the pathologist looked at some slides off of that and did see abnormal cells there. Kind of over in this region here, there were a couple of lymph nodes that looked suspicious for having tumor involvement if this were cancerous, and so I biopsied. It's about 2 centimeter lymph node over here that I did a biopsy of that as well, and he's seeing similar cells here as what he was seeing there. So that'll be part of the overall evaluation of this. There was enough inflammation that limited my views of a couple of the blood vessels that we'll usually look at. So if we get a clear diagnosis here, when we get the final path, and it's something we need to have a pancreatic surgeon look at, they'll want to look at the other scans and kind of compare where this looks like it's at compared to the blood vessels. The one blood vessel where I do that block, the celiac artery, looked like it was away from anything here, and I was able to do that block without any problems. So like I said, we'll see kind of how you behave on if that kind of kicks in and makes any difference in your pain. And even if it doesn't take it all the way down to 0, if it takes it down enough where it can be more easily managed with pain medications, it can help from that standpoint as well sometimes.
So what will our steps be from now on? I mean, for the next.
So next steps, we'll need the final results from this. Your primary GI team is Dr. Levin's team. That's, I think, Dr. Rojas may be covering over there. My PA, Andy, that you guys met, was going to coordinate getting results over to, I think it's Heather's, their PA, that's covering inpatient over at St. Francis with Dr. Levin's and Rojas group. So he was going to coordinate making sure that they knew what I was seeing, what the biopsy showed, and they'll be kind of the primary GI management team. We'll watch for the results and kind of how somebody will follow up to make sure that you've gotten those results at some point, that you've had follow up. But the next steps are usually will be getting a cancer doctor to look at things, likely getting a pancreatic surgeon to take a look at the images and see what they think as well, and all those things kind of in combination. So.
What's that mean? They'll have to do surgery, or they're gonna? I mean, what's that mean? I don't know what that means.
That's what that means. That the next phase is getting all those people on board that help make those decisions. Because I give input, I get the biopsy and help get the information. That's one piece of the puzzle, and then you need everybody kind of coming together as a team, looking at it to help make decisions about what the best approach is.
Because if, like, for example, if they have pancreatic cancer, they do surgeries for that, correct? Or can they?
So sometimes they can't. Having lymph nodes here can potentially impact that, and that's where we need input from the cancer doctor, and they'll probably want to wait until they have a final readout on the pathology, so they know for sure if this is involved, and then the pancreatic surgeon will take a look at the images from the CT scans and see how things look.
And how long does it take to get the results back from the test you did today, the
Sometimes it can be 2 or 3 days.
Okay.
Sometimes it may be a couple of weeks. With the quick read he gave, I expect it's going to be a shorter time frame rather than something where he wants to send it off.
I see.
Sometimes he'll want to send it to like Mayo Clinic or something where it can be a 2 to 3 week process. But based on what he was seeing, I expect it's going to be a shorter interval to have that
Okay.
answer.
Sandhouse.
Okay,
Yeah.
very good. So thank you very much,
Uh-huh.
and we'll he'll stay here.